Hi class. Today we're going to talk about electrical stimulation. The first chapter you're going to want to read is chapter 11. It is an introduction to just basically what electrical current and electrical stimulation is. A week from now we will be starting out with the neuromuscular. Electrical stimulation will be our focus, and interferential current. And then the following week we'll work more on the transcutaneous electrical nerve stimulation, which has to do more with pain and high volt and iontophoresis. So I know you have an exam in the ultrasound and soft tissue massage, but you'll want to kind of overlap and start looking at your E-stim because it is a heavy type of material, a little bit more difficult to understand. So at least kind of start listening to the YouTube videos here and reading your chapter, the first couple chapters, to get yourself started. And if you have any questions, you can let me know, okay? So our objectives are to understand the different healing phases, the goals for each phase, and how to apply the correct electrical stimulation, including parameters to achieve an optimal response. So again, you're going back to the acute inflammatory phase, the proliferation phase, and the maturation phase. And for each of those phases, based on those goals, is how you're going to determine what type of electrical stim and what type of parameters you're going to use. Not much different than when we talk about ultrasound or soft tissue mobilization. We always are wanting to know what phase the tissues are in so that we're giving it the optimal amount of facilitation to heal. The next objective is to identify the indications, the clinical applications for each type of electrical stimulation and rehab. We often use it for strength training, we use it for muscle re-education, we use it for pain control, wound healing. So we have many different options. List the parameters for each type of electrical stimulation. And again, I would encourage you to go to the back of that first chapter and read the glossary of the different terminology, as it is a new language for you and they will interchange. So you'll want to know what a pulse duration and amplitude versus intensity, frequency, a cathoid versus an anoid. So you have a little bit of terminology that you're going to need to memorize. And that's what the next objective is telling you, to be able to demonstrate the knowledge of the terminology used to describe parameters for electrical stimulation. You're going to want to demonstrate knowledge of the different pain theories, nerve fibers involved for the different types of electrical stim. So here, this would be a nice review for you as well. You remember you have the gate control theory, which is going to work more on the ascending pathways. And then when we get to where we actually are producing some pain to release those self-opiates, which are our chemical transmitters in us that help relieve pain, that's coming via the descending pathway. So you might want to review that again in your Cameron book so you know the difference between ascending and descending pathways and those pain theories and how they work differently, so that you'll be able to explain them in layman's terms to your patients. You're going to be able to differentiate between the different waveforms and currents. We know that we have direct current, alternating current. We have a monophasic versus a biphasic waveform. We have an interferential waveform, so you'll learn all about all those different types. Be able to describe what occurs physiologically with these different types of electrical stimulation. Be able to describe the differences between a normal muscle contraction and one produced by NMES, which is neuromuscular electrical stimulation, or a Russian stimulation protocol. And this is really important, and you'll read this in chapter 12 to know the physiology of how our normal muscle contraction works versus the one that we produce with an electrical stimulation machine, and why that's important. You're going to be able to correctly document a SOAP note for an electrical stimulation treatment, including all the different parameters, positioning, skin checks, and be able to know how to correctly document for that so someone can replicate your treatment. Be able to apply all the above objectives to case scenarios of patients where the goals indicate a type of electrical stim will be beneficial for their recovery. So it's a lot of objectives, but this is basically going to cover 3 or 4 units in a couple weeks in the lab. So the electrical current is basically the flow of those charged particles, and they may be electrons or ions. Basically, the effect of electrical currents is to get a nerve depolarization. You want that electrical current to depolarize that nerve membrane. The electrical current must have a sufficient amount of amplitude or intensity and last a sufficient length of time, which we consider the pulse duration, in order to get a nerve membrane potential, and which you probably all remember is called an action potential. And that is our goal, is to get that action potential to get the response that we want from either the sensory or the motor nerves. We have what we call neuromuscular electrical stimulation, and so that's where we get that action potential that actually stimulates that alpha motor neuron, creating a muscle contraction. It depolarizes that muscle cell membrane directly. And this is just showing you basically what an action potential looks like. At its resting point, it's a neutral charge, and it rests somewhere between 60 and 90 millivolts right here. Okay? So we have sodium outside the cell and potassium inside the cell. In order to get depolarization, you need enough stimulus that sodium channels in the cell membrane open rapidly and the potassium channels open slowly. The sodium rushes into the cell and causes that facilitation. To be able to repolarize, the membrane potentially reaches about 30 millivolts. The permeability to sodium decreases and potassium channels open. The potassium flows out and then turns the membrane potential back to its resting state. We have two refractory periods. One is considered the absolute. While the nerve is depolarized, there is no additional action potentials that can be generated no matter how strong a stimulus is applied. So you have to allow it to go through that period before you can re-stimulate it again. A relative refractory period is that depolarization before returning to the resting potential. There's a brief period of membrane hyperpolarization. And during this period, if you create a greater stimulus, you can get another action potential. And this graph here is going to show you that. So here you can see, here's our sodium and our potassium and that membrane, and it's exchanging back and forth. You get that action potential, up it goes. And during this time period, we call that the absolute refractory period. Remember, no matter how much more stimulus you try to give that, you're not going to get another action potential. Then once it's kind of coming down, then you have this relative period of you just would require extra stimulus in order to create another action potential. Next, we'll talk about the strength duration curve. It gives you a good explanation in your book, and I'd encourage you to read this. And under the clinical pearls, it'll basically sum up what we need to know. Here's the graph showing you that a minimum amplitude and pulse duration needed to depolarize a nerve. So when we have a sensory nerve, like our A beta nerves, it's a short pulse with a low current amplitude. So that's a short pulse duration, and it needs very little intensity in order to stimulate it. Now, in order for us to get a stimulation of that alpha motor nerve, we need a longer pulse with more intensity or more amplitude and that's the purple line right here that's showing you that, and is giving you that range of microseconds that you need in order to be able to stimulate that. And then this is in milliamps over here. Okay. Then you get to your A delta. Remember, the A delta pain fibers are the sharp ones that are myelinated. And so the C fibers and a denervated muscle, they actually need longer pulse and a higher current amplitude, and that's why they create a more uncomfortable sensation. So in summary, a sensory stimulation, generally anything less than 80 microseconds. A muscle contraction, you're going to need something between 150 and 350 microseconds. Some machines it's fixed, some you have that ability to adjust, and that gives you a little bit more flexibility when you're working with a patient to get the contraction that you want. A lot of times you'll have a smaller person, either a young child or just somebody who is more petite, you're frail elderly. You're going to want a shorter pulse duration with them in order for it to be more comfortable and for them to be able to tolerate it.